sticking with health news, and there's some good and bad news when it comes to cancer. According to a new study of more than 500,000 people, young women are more at risk than ever before. Americans under the age of 50 saw an increase in cancer rates, with the largest increase being women in their 30s. So the study points to obesity and processed foods as some of the main drivers behind this increase. But there is also some good news here. Cancer rates in patients aged 50 and older decreased between 2010 and 2019. All right, let's bring in Dr. Jayne Morgan, the Executive Director of Health and Community Education at Piedmont Health. Doctor, thank you so much for being with us. First, before we get into really the specifics, what is your biggest takeaway from these new numbers? Because as we said, there's this bad news, but on the flip side, there's some good news for people over 50.
You know, Nichole, that's absolutely correct, and thank you for having me. We do see that cancer rates overall are decreasing for our population, but we have this demographic of younger people where we see cancer rates increasing. They seem to be correlating with this 20-year increase in obesity as well in this demographic. It seems to be paralleling the increase in cancer rates as well.
All right, so I want to dig into some of these numbers a little bit more here. So overall, the increase in cancer rates for those under 50 was only 1%. So it was just a slight increase, but within that 1%, there was a nearly 20% increase in people in their 30s. We talked about women in their 30s there. Again, we said that increased drinking, obesity, processed foods, some of the reasons. But doctor, my question is, aren't we seeing these underlying factors in all age groups? So why is it potentially affecting this particular group differently?
And so we have something called the toxicity of obesity, and it seems to be correlated with the duration of time that the body spends in an obese or overweight state. It used to be in previous generations when people gained weight, they were in their 5th and 6th decade of life. Now we see people often from childhood who have obesity, and by the time they are in their 30s and 40s, they've had 3, 4, and 5 decades of ongoing obesity. We haven't had that type of demographic nor that type of data before. And so the duration of the time that your body remains in this obese state seems to be critically important, as well as hormonal balance that occurs during that time.
Oh, that's so interesting. Because yeah, I would be interested to see when we really started to see that uptick in childhood obesity, and whether or not then it coincides with these new numbers. That definitely makes sense. Doctor, before we let you go, we certainly can't hear it enough, but what are the easiest ways we can try to reduce our risk of any cancer?
You know, absolutely. We want to adopt healthy lifestyles, and that means exercising more, trying to eat less processed foods, whole food, but also trying to maintain a weight that is decreased. The other thing that we are doing as a medical community is we're looking at our guidelines and whether or not we need to begin screening for cancer at an earlier age, because often the screening begins at an age beyond 39 years of age when these cancers are developing. And then by the time we catch them, they're more advanced as well in this younger demographic.
All right, Dr. Jayne Morgan, we certainly appreciate your expertise. Thank you. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.